Imagine you are actually having a casualty in the house, and the mother, or whoever is actually up in the house, doesn't have any idea about CPR. By the time the health experts will be in, the vitals of the individual are actually gone.
Hi, welcome back to the channel and thank you so much for tuning in. If you are new to this channel, it's all about giving back to Africa in the areas of health and education. Today I'm talking about cardiopulmonary resuscitation, what we call CPR, sometimes referred to as basic life support. What CPR does is it saves lives during a cardiac arrest or when the heart stops beating or is unable to effectively push blood circulation around the body to the brain and other vital organs of the body. So what it does is it buys time till further help arrives. So it's an essential training for all health workers. If you're a health worker anywhere around the world, you will know that CPR or basic life support is a mandatory training that you need to do at least once a year. And depending on your specialty, sometimes people go on to do the advanced version, immediate life support or advanced life support. Certainly, if I'm unwell and I need CPR, I would love the people around me to be able to perform this technique. So at the recently ended conference organized by the GDNA in Accra, Ghana, an organization by the name Elijeko provided CPR training for the nurses who attended the conference. And up to 200 nurses were expected to take part in this training. As you can see, the nurses lined up eagerly waiting for their turn to practice. One thing I like about this training, having done it myself every year, is that it's hands-on. There's no way you can learn CPR theory. You have to practice, practice, practice until you get it right. Right from finding the patient unconscious, looking for dangers around, trying to arouse them, calling them, checking for the airways, calling for help, and then getting on to the chest compressions. It was interesting and exciting to see the nurses and midwives engaged in practicing and making sure that they get the technique right, right from where to place your palm on the chest of the patient to the depth of the compressions. The trainers also provided training on basic life support for infants.
We urge our people, and virtually everybody should actually partake in the CPR training session. You can actually invite us. You can also invite any other instructor who is actually well versed in the training of the CPR, because it helps. Imagine you are actually having a casualty in the house, and the mother, or whoever is actually up in the house, doesn't have any idea about CPR. By the time the health experts will be in, the vitals of the individual are actually gone. So if you have upper hand information and knowledge about CPR, you can actually start doing something before the experts themselves will come in. And as you can see, the training session is ongoing with the BLS, the CPR, infants and adults. It's actually going on for the nurses and other healthcare aspects. So we entreat each and every one of you to actually take a nose dive into what CPR is actually about, and other emergency, how they call it, training is all about. Once again, I am Advanced AMT Nanajan Bicham,
Okay.
and I'm with the Ghana National Ambulance Service, at the same time Elijeko Foundation.
Yeah. Thank you so much. So, who do you train? Do you train only health workers?
Not at all. Not at all. We train institutions, educational, institutions, and also, let's say, churches, groups, whosoever is actually interested. Because most of the time we even drive all the way to deprived, areas within the country to just give them free, opportunity to train.
That's really impressive. So, do you use defibrillators?
Very well. Yes, yes. We do. Even as of now, we actually brought dummies, are mannequins, and also the AEDs. These are what we actually using it to train.
Yeah.
Yes, so yes, we use them. Automated external, defibrillators. Yes, these are the ones that we use.
Can you give us an example where CPR has saved somebody's life?
Okay,
An
well,
example where somebody's life has been saved.
okay, all right. So there was a young boy who actually was about to actually drown. So he was unconscious, and then we were actually called upon to that scene, and then it was the CPR that's actually revived or resuscitated him, and then we actually moved him to the hospital for further health care. The sad thing is, one of the trainers was telling me that they have to hire the mannequins, the dummies used in the training. They have to hire them in order to, perform the training and then take them back. So if you're listening or watching anywhere in the world and you have access to, the mannequins or the dummies and you are able to donate, kindly get in touch.